I'm discussing behavioral science and neuroscience as it relates to patient engagement. Well, there's a huge dearth of discoveries in the last 5 years, and so it's about translating the behavioral neuroscience findings at the sort of anatomical and behavioral psychology level and being able to translate those into actionable patient engagement strategies. And in this case, I'm going to be focusing on LDL cholesterols. Well, it has to do with fast brain and slow brain. So, those are my sort of colloquial terms for systems in the brain that, take a longer time to process and to stabilize versus those in the unconscious mind that we, kind of have an autopilot all the time. And so, the things that we see as doctors is we ask people to do slow brain activities when their life is predominantly fast brain driven. And then, of course, the fast brain stuff beats out the slow brain stuff. There's either two strategies that work. One is to stabilize the slow brain activities through support, accountability, some sort of slow practice of that kind of thing, or speeding it up to the equivalent of fast brain activities through routines, linking it to existing behavior patterns, shortcuts, mental shortcuts, small algorithms that are sort of portable and memorable for people to be able to say, oh yeah, I didn't mean to put that cupcake in my mouth, that kind of thing. I think people do it all the time. They put their keys by the door so that they know, where they are all the time. So they put their shoes a certain place, that kind of thing. It's just expanding that skill to actually things having to do with your health and behavior change in that area. So just like the patients, the doctors will have to have some sort of slow brain moment or some sidebar where they design what they're going to say to the patients that accelerates the patient's ability to remember and make it portable and competitive against the rest of their routines and habits. And for the physician, a physician obviously who just keeps running a million miles a minute, they're on fast brain themselves. So that's not going to change anything. But if they design something in those few moments, after work or during a workshop or those kinds of things, then they can change their own behavior to then affect their patient's behavior. Two things. One is that it works with how your brain actually behaves in the world. And the second thing is that you really, that's the only way that people change anything. If you break down the things that actually work, they all follow these patterns. That my hope is that this is able to keep up with and be an adjuvant therapy for the new therapies, the science of the sort of microbiology and the sort of immunology and all of that kind of stuff. Forging ahead, I think that the neuroscience, the behavioral science need to come up and join with that in order for it to be effective.